kind of shot?
For this single mom taking care of 2 boys,
And how old are they? 4 and 8.
health insurance is an afterthought.
I haven't had health care in 6 years.
And she's not alone.
It was always too expensive.
I do house cleaning. I have a small business.
It's really hard for me to get health care.
For millions of uninsured Americans, the Affordable Health Care Act is supposed to change that. But at what cost?
Economic theory says that it should lower prices, but there's a whole lot of unintended consequences.
In Ohio, state officials say the average premium is around $230. Next year, under the new health care law, they estimate the cost will rise to $330. We asked Professor Ed Schumacher why.
There's things that now insurance companies didn't have to cover, they do have to cover.
Schumacher says if you take a young, healthy person, they can buy insurance on their own for relatively cheap. But when that person goes into these exchanges set up by the government, where for the most part they're charging a consistent price for everyone, that individual is going to pay more.
The fact that we can have our children on our insurance policies until we're 26 is great for individuals with young adults, but everybody else has to pay for that by having slightly higher premiums. So there's all these little things that are going to make premiums slightly higher.
There's a lot of unknowns.
Dr. Virginia Mika is the executive director for Carelink. It's a financial assistance program in San Antonio, Texas. Carelink plans to help many of its 53,000 uninsured clients enroll in the new healthcare exchanges.
For people who already have insurance through their employers, they probably will not see any change in their premiums. But for people who have not had insurance, well, then they're going to have to go into this marketplace and pick a product and then see what subsidies they qualify for.
The lower your income, the more you can save. For example, a family of 4 with a household income of $50,000 would pay $9,800 as a premium in 2014. That's according to the Kaiser Foundation's calculator. Of that, the family pays $3,300 and the government pays $6,500 through subsidies.
You never know when something's going to happen.
Figuring out just how much the single mom will pay is a priority.
Cost is definitely a factor. I can't, put my child support that I get into my own health care.
Depending on how much it costs, she'll decide if she can afford to opt in. I'm Grace White reporting.